Hello and welcome to this learning module. Today we will provide an overview of how EMS fits into the continuum of care that a patient receives. This video is intended to supplement any readings or coursework assigned by your instructor. The objectives for this learning module are: number one, discuss the EMS provider's role in the continuum of patient care. Number two, explain the importance of effectively communicating with bystanders, other healthcare providers, and first responders at the scene of a call. And number three, describe the advanced provider's role in patient turnover. In medicine, the continuum of care describes the delivery of healthcare over a period of time. This begins when the patient sustains an injury or illness through all levels of care to discharge and beyond. This can include pre-hospital providers, emergency department providers, medical specialists, rehabilitation and long-term care facilities, discharge planning, and follow-up care. In the image on the screen, we see the continuum of care that a trauma patient may receive after experiencing an injury. Continuation of care is important to ensure unnecessary medical procedures, testing, and medications are not repeated, which is neither healthy for the patient nor cost-effective to a healthcare system. Each time care is transferred from one provider to another, the patient's information must be reliably and completely relayed to ensure proper continuation of care. As EMS providers, we get to care for a patient in their home environment, which is something most healthcare providers rarely get to do. For this reason, it is extremely important that we carefully evaluate and document any residential or environmental concerns that we feel may be detrimental to the health and safety of our patient. This includes things like inadequate food, an unclean environment, a home that is not safe for the patient to move about, or any other indicators that the patient may not be able to care for themselves while in their home. If information such as this is not relayed to the receiving facility, the social services or other support systems cannot be activated to provide support once the patient is discharged from the hospital. When an emergency happens, it's quite often a family member, friend, or other bystander who recognizes the need for assistance and places the call to 911. When calling 911, it is important to answer all questions with as much detail as possible and remain on the line until the telecommunicator or dispatcher tells you it's okay to hang up. Once an EMS crew arrives on the scene of an emergency call, a provider will need to gather as much information from the patient, family, friends, and/or other bystanders to get a thorough understanding of what transpired prior to their arrival. Gathering a history of the patient's current situation or complaint, as well as a medical history, is extremely important. Medical history includes compiling a list of any medical problems or procedures that the patient's had, a comprehensive list of medications and dosing information, and a list of any medical allergies. EMS crews will use this information to better care for the patient and must pass this information on to the medical staff at the receiving facility. When a call for aid is received by a 911 telecommunicator, there are multiple processes that are initiated. As the call taker enters the information into the computer-aided dispatch system, the system determines who the closest available responders are based on the location entered by the call taker. Once the type of emergency has been determined, the appropriate resources are dispatched. Once responders are on their way to the call, the 911 telecommunicator will update them with as much information as possible. As appropriate resources are dispatched, the 911 telecommunicator will also provide emergency care instructions to the caller. 911 telecommunicators are trained to use emergency medical dispatch, or EMD guidelines, to talk a bystander through how to help somebody who's having an emergency. Bystanders can be coached to provide first aid, perform CPR, or even deliver a baby. Once on scene, if responders determine additional resources are required, these resources are requested through and coordinated by the 911 dispatch center. This might include the need for additional ambulances, a specialized rescue team, or a helicopter to provide air medical evacuation. The image here shows a 911 telecommunicator taking a call. If you're ever presented with the opportunity to observe in your local 911 call center, I highly recommend you do it. An understanding of how your 911 center operates will help you as you grow into your EMS career. Depending upon how your system operates, first responders to medical calls in your area will likely be either law enforcement officers or firefighters. Additional first responders may include park rangers, Department of Transportation Highway Emergency Assistance Teams, ski patrol, lifeguards, and others with first aid, CPR, and/or basic level medical training. First responders are an important part of the continuum of care because they can often get to the scene of the call before an EMS unit. This enables them to initiate care and provide updates to the responding EMS crew. Additionally, first responders and emergency medical responders are often trained and have access to automated external defibrillators and therefore can have a positive impact on patients who have suffered a sudden cardiac arrest. When an EMS crew arrives on scene where a first responder has initiated care, it's important to gather as much information regarding their encounter with the patient as possible. Doing this enables the crew to continue the care that was initiated by the first responder. Additionally, any information the responders obtained regarding the victim's past medical history, medications, and allergies is extremely important and should be documented. Any vital signs such as the patient's heart rate, breathing rate, and/or blood pressure should be recorded so you know what the patient's baseline was when the first responders arrived on scene. In the image here, we see the District of Columbia paramedics working with firefighters and law enforcement to care for an injured man on DuPont Circle in Washington, D.C. In addition to responding to emergencies at private residences and roadway crashes, EMS crews will also respond to businesses and workplaces for medical and traumatic emergencies. Some workplaces may have on-scene medical teams who responded to and initiated care prior to any first responders arriving on the scene. EMS responders will communicate with these healthcare professionals to determine the history of the present illness or injury. They will also obtain information about the patient's past medical history, a list of current medications, and information regarding patient allergies. The EMS crew will also record any vital signs and medical interventions provided by the healthcare workers so they can continue the care that was initiated prior to their arrival. This is important because if a medication or intervention was already provided, it may not be medically appropriate for the EMS crew to repeat it. EMS will also be requested to respond to other healthcare facilities such as physician offices, skilled nursing facilities such as rehabilitation centers and nursing homes, and even urgent care centers. These facilities may have physicians or other advanced practitioners such as physician assistants and nurse practitioners. They may also have registered or practical nurses, medical assistants, and/or health aides. These caregivers should be able to provide information regarding the patient, their situation, and any care that was initiated prior to arrival. Whenever possible, it's best to speak with the highest level provider at these facilities. When responding to a private residence, EMS crews may encounter home health nurses, aides, therapists, or hospice workers. These care providers can provide invaluable information about their clients, so it's important for us to gather as much information from them as possible. Ultimately, EMS providers must be respectful and professional when interacting with any on-site healthcare workers because this will benefit the patient, prevent duplication of interventions, and ensure proper continuation of care. While on scene and during transport to definitive care, such as a hospital emergency department, EMS providers will continue to evaluate and provide care to their patients. Unstable patients should be reevaluated at least every 5 minutes, while stable patients should be reassessed at least every 15 minutes. When able, the provider who is caring for the patient in the back of the ambulance should notify the receiving facility that they are bringing in a patient. The EMS provider will provide basic information to the emergency department or ED staff, including their ETA, or estimated time of arrival, the patient's age and complaint, any care provided to the patient, and a current set of vital signs. This enables the emergency department to prepare a room and request any necessary assistance based upon the incoming patient's condition. Once the EMS crew arrives at the emergency department and moves the patient over to the ED stretcher, one of the EMS crew members will provide a verbal report to the ED staff. This report must be given to somebody with equal or greater training than the EMS provider. In many instances, the report is provided to a registered nurse or RN. To ensure the ED staff is able to continue the care that was initiated in the field, a detailed verbal report must be provided. Patient demographics such as age, an explanation of the illness or injury, past history, medication, and allergies must all be relayed to the registered nurse. Additionally, all care that was provided prior to the arrival at the ED must be conveyed to the ED staff. This includes care from bystanders, first responders, other healthcare providers, and the EMS team. Again, this information is vital to ensure the continuation of care from the field so no interventions or medications are inappropriately repeated. Depending upon your local protocol, your agency may be required to provide a written preliminary call report that contains much of the information provided in the verbal report. Systems that require this do so because it helps to support your verbal report and ensure a continuum of care for the patient. Once you clear your call, you will also enter an official patient care report in your agency's National Emergency Medical Services Information System, or NEMSIS compliant computer system. This will serve as your official patient care document, and a copy of this will be electronically relayed to the patient's record at the receiving facility. Care must be taken to ensure that the EMS provider relays an accurate verbal report, preliminary written report if required, and a patient care report. So what happens to the patient after we transfer care at the emergency department? Patients will continue to be evaluated by the ER staff, blood work and other imaging such as x-rays will be completed, and the ED physician or advanced providers will determine one of the following dispositions. The patient may be treated and discharged from the emergency department with an order to follow up with their primary care provider. The patient may be discharged and referred to follow up with a specialist. The patient may be admitted to the hospital for follow-up assessment and care, or the patient may be transferred to a specialty care or long-term care facility that is better equipped to manage their situation. If the patient requires transport to a specialty care facility, your agency may be requested to return to the emergency department to transfer the patient. Otherwise, a private ambulance transport service may be used. It is important to emphasize that the patient information provided by EMS to the ED staff, the EMS patient care report, and any other information provided will become a permanent part of the patient's medical record regardless of their hospital disposition. This is why EMS providers must be proficient at history taking, patient assessment, and documentation, because the evaluation and care that was initiated in the field will continue throughout the patient's care for this emergency. Depending upon your agency's protocols, EMS may need to transfer a patient to an alternate destination other than your local emergency department. For example, in rural areas, the patient might be transferred to the care of an aeromedical crew for helicopter transport or medevac to a specialty care facility for advanced level care not available locally. This might include trauma, burn, pediatric, or cardiovascular specialty care. In the event of inclement weather or other special situations, the EMS crew might be instructed by medical control to transfer the patient to a specialty care facility by ground if medevac is unavailable. If medical protocols allow, patients with minor injuries may be transported by EMS to an urgent care facility for treatment. Patients who are intoxicated or have overdosed may be transferred to a rehabilitation treatment center for monitoring and/or admission. Patients who have experienced a behavioral emergency may be transferred to a psychiatric health facility. It is important that all EMS providers remain current on their agency protocols regarding alternative transport options in their system. Depending upon the level of care that was required by the patient, the advanced EMT or paramedic may be required to provide the turnover report at the emergency department and write the patient care report. If the patient requires advanced life support or ALS care from an advanced EMT or paramedic, then that provider must provide the report to the staff at the receiving facility, as well as complete the electronic patient care report. An ALS provider should never rely on an emergency medical responder or an emergency medical technician to transfer care or to write the patient care report for a patient who received ALS care. We will learn later in this module that if this were to happen, the ALS provider may be accused of abandonment for failing to appropriately transfer care of an ALS patient to the receiving facility. This brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, consider going back to review any content that you struggled with. Thank you for watching this learning module.